Today on Let's Wrap.
Any chronic illness, you can empathize really easily with another one. And I have had IVIg. I've mentioned the Guillain-Barré. IVIg saved my life. It arrested the Guillain-Barré before I had to be put on a ventilator.
HPC started as care specialists in hemophilia, but quickly realized their expertise could benefit Ig deficiency, caused by a person's inability to produce antibodies. Ig deficiencies can often be addressed through replacement therapies, including intravenous immunoglobulin and subcutaneous therapies, often referred to as IVIg and SCIg. HPC's care system covers the entire treatment process, from pharmacy services for the specialized delivery of these products to skilled nurses trained in administering IVIg and SCIg properly, and additional resources to ensure patients achieve the best outcomes by following their therapy guidelines.
They take that IVIg and it is like a super boost to your immune system. So people who have, for any number of reasons, are immunocompromised, IVIg, it's like an immune system in a bottle. When I had my Guillain-Barré, it arrested what was being done to my nerves, and my immune system couldn't fight it, but the IVIg stopped it.
Tim Andrews is an HPC patient who has courageously battled hemophilia and later became an IVIg patient when he was diagnosed with Guillain-Barré. For almost 15 years, he's worked for the company, helping patients and providers with a critical perspective on their needs.
Someone in the company likes to say, just throw the prescription over the fence and we'll take care of everything. That's it. Once we get that script and all the documentation that we need, we're going with it. We're going to finish it and you don't have to worry about it again.
How is HPC positioned to utilize Ig and all the benefits for patients moving forward with a variety of disorders?
We work very closely with our physicians and our physician offices to get referrals from them. And then sometimes if you refer out to a pharmacy, it can take weeks to get a PA approved, a prior authorization PA. Our team was really good at that, and they don't take no for an answer, and they are right on it. We can usually get a PA approved within 48 hours. So that gets that patient, that drug, that much sooner.
Tim says if HPC isn't authorized to be the provider, it won't be kicked back to the providers. They'll follow through even with another pharmacy to make sure the provider doesn't have to start over and the patient gets the medicine more quickly. And when providers call, there's a real person on the other end of the line.
If you always talk to, say, Christy at our office, and you're from a doctor's office, then you can pick up that phone, hit the directory number, get Christy or Heidi. You're always going to talk to Christy or Heidi.
I'm sure that's a big relief for a lot of the providers with all the headaches they have to deal with.
And it frees up those nurses to do what they love, which is take care of patients, not do paperwork.
How has HPC been able to put patients at ease or more at ease during the pandemic?
With everything that's going on in the world with COVID, you don't want to be going into a hospital and into a crowded infusion suite when you could have a nurse come to your home and that's the only person you have to interact with. The safety of your own home to get your infusion there, I think is very comforting. That's one way we're wrapping around that patient. We're keeping them safe at home. It's funny, it starts with the physician and they don't even know it. They're getting wrapped around too. We're taking care of them just like we would take care of our patient.
You've been listening to HPC's Let's Wrap, a podcast by HPC Specialty Infusion for patients and providers. We're proud to specialize in patient health and happiness at hpcspecialtypharmacy.com or call 1-800-757-9192.